It seems like most everyone here knows someone who recently got diagnosed with COVID-19, and that got us to wondering, is there an uptick in cases here? CBS 2 political investigator Dana Kozlov spent the day looking into that, and she joins us now. Dana?
Joe, outbreaks are still happening, but on a smaller scale. Experts, though, say it's time to start thinking about the fall. Here's the good news when it comes to COVID-19 in the Chicago area.
Right now, we're still seeing the lowest levels that we've seen with new cases since the beginning of the pandemic.
And here's the not so good news.
We're still seeing COVID, though. There's still people in the hospital. They still get it. They're still at risk of spreading it.
I think as time goes by, we will see that COVID will evolve into more of a seasonality, a seasonal kind of boost.
Especially as the summer winds down and people head back to school and back indoors. Both Dr. Rachel Rubin and Dr. Michael Bauer say being up to date on the COVID vaccine and boosters are still the best way to stay protected from getting really sick.
Which means they had the initial series plus the booster plus a bivalent booster.
But Cook County's senior medical officer says only 21% of Cook County residents are fully vaccinated. Bauer says Lake County's rate is slightly higher at 25%. In September, the FDA is expected to approve the next booster, the monovalent booster. The Centers for Disease Control will then recommend who should get it.
So it's not going to be a weaker or less effective vaccine. It just means there's no longer a reason to include the original strain.
And what if you're in the 75% or so who aren't up to date?
Just go ahead and get the new one. Get the monovalent when it comes out. Don't worry about catching up.
And both doctors I spoke with also believe the CDC will recommend everyone get that new booster, especially those who, of course, are immunocompromised and people over the age of 65. In the newsroom, Dana Kozlov, CBS 2 News.
Thank you, Dana.